Ingraham from Washington tonight, and this is a special edition of the Ingraham Angle, Inside the Issues. Tonight, we bring you the political and cultural issues shaping our current conversations, from the Iranian conflict to the border crisis, from the 2020 battles to the issue of abortion becoming front and center in this presidential election. This special will cover all of it. On a related note, we're going to speak to the Independent Women's Forum's Heather Higgins, wrote a terrific piece. You have to read it. The risks of a pandemic if we do not solve the crisis at the border soon. The border crisis isn't just the border state issue. No, it's a national issue. My next guest explains why the illegal invasion actually puts everyone's health at risk in America. Coming up.
Over 5,000 migrants have been quarantined by ICE officials due to exposure to contagious diseases. But agencies like HHS will soon run out of funding and is starting to cut services. Until we have addressed the border crisis legitimately, Congress should not be conducting business as usual.
Bingo. And warnings like those, mostly from Republicans, by the way, are largely ignored by Democrats, who failed to do much of anything in supporting the president's efforts in finding an actual solution, a workable solution to this border crisis. Now, these health issues that we've been documenting here on the Ingraham Angle might seem like they're isolated in these various encampments, but my next guest is warning that if our border situation is not solved, this could have devastating nationwide consequences. Heather Higgins is the CEO of the Independent Women's Voice, recently wrote a phenomenal piece for FoxNews.com titled "Border Crisis Puts Everyone's Health at Risk. Pandemics Can't Become the New Normal." Heather joins us now. And Heather, explain for our audience what a pandemic looks like and why this situation at the border puts us at risk.
Well, pandemics, as you know, is when a disease just sort of takes off and goes crazy. And you, of all people, you've been down at the border. Your show has been documenting all the different challenges that are happening. First, let's stipulate, most immigrants who come across are perfectly healthy. But the reality is now that adults and family groups are getting through with no medical checks and no proof of vaccinations. And that's because there's this enormous CDC, very counterproductive loophole. Legal immigrants and American citizens all encouraged to vaccinate, proof of vaccination, et cetera. Sure. But if you come in illegally, as well as some other categories, there's absolutely none of that.
So you're saying that in this current crush, Heather, that we're seeing at the border, 140,000 people in the month of May alone, apparently the June numbers are through the roof as well, that most of those people could be bringing a variety of diseases into the country. We've seen TB outbreaks. We've seen the measles. We've seen, obviously, mumps. And we just don't have the infrastructure, or we don't have the will or combination to actually get these people screened. Just the sheer number alone, we can't do it.
The World Health Organization just pronounced that pandemics are going to be the new normal. And they said that one of the contributing factors to this is the porousness of borders. So by the logic of the World Health Organization, border security is a public health issue. It is extremely important. I'm not saying that necessarily that any immigrant has a disease. Absolutely not. Most immigrants are completely
healthy. But we're playing roulette.
But you're playing roulette.
We are playing. This is like a game of roulette that none of us would play with our own families.
No.
And now we're letting the whole nation play with it. And we have to get to what happened in Los Angeles, too, with this huge problem of homelessness, stunning numbers in L.A. because people are living on the street. Some of them are illegal immigrants, not all. And they're dealing with a huge health crisis, and it's up 16% from last year, according to the Los Angeles Times. This raises yet another health issue. How can we police these potential outbreaks from illegal immigrants when we can't even get a grip on American homelessness and the intermingling of illegal immigrant homelessness, legal immigrant homelessness, and just regular old American homelessness on the streets of Los Angeles? You mix all that together, Heather, and this is not alarmism. This is public health that the Democrats always say they care more about than the Republicans.
They claim to care about it, but I think the proof of the pudding is in the results. And one of the things that people need to focus on, for example, is that let's take measles, which is obviously what the big outbreak is right now. I don't think most people understand the seriousness of measles. I certainly didn't understand the seriousness of measles. I got through it as a kid. And most of us think of it like one of those episodes of the Brady Bunch, where the Brady Bunch are just thinking it's an excuse to not go to school and have a good time. But in fact, it's serious. It can lead to permanent brain damage. There were 110,000 deaths in 2017. And what you have now is that it is also highly contagious. So you have busloads of immigrants being dropped off at a strip mall.
This is a complete scandal.
And so a mother could be there with her 6-month-old infant who's not old enough to have the MMR vaccine. Somebody could have sneezed an hour before, and suddenly
the critics would say, "Oh, we're just being unnecessarily alarmist. Oh, there you go again. It's the caravans. It's the people coming." And this is just more anti-immigrant rhetoric. This is what the Democrat 2020 candidates are saying, Heather. This is what Democrats who used to be for border enforcement are saying. Every time we bring this up, they're laughing it off, basically.
I'm actually pro-immigrant. Immigrants are some of the most vulnerable here. People who don't have vaccines themselves, which we're finding a lot of these immigrants don't. When they're in these caravans, they're susceptible to the sickness. We now have more children. They're susceptible to illness. But what's really weird and interesting is when people are intercepted or apprehended, they're sick. When they're here, they're not. How is that possible? Well, the New York Times and the Huffington Post both reported that once people are here, there's an entire network of underground health care.
We have that. Stymied by a lack of health insurance, fearful of the medical center's potential connections to immigration authorities and longing for familiar remedies.
And not only that, if you are a doctor who is practicing without a license, that carries actual jail time in all 50 states. So these guys are not going to have the CDC on speed dial. They are not going to report it, or the people who are here illegally just use a false name and go to another doctor, and they're not reported as illegal immigrants.
We're going to stay on this. This is beyond obscene, it's insane, and it's putting our health system, every one of you, I don't care if you like Trump, don't like Trump, Democrat, Republican, Independent, this is about health. And Heather Higgins has been on this. Heather, thank you so much. And an important message for all Americans to hear this tonight, and we thank you.